Record. All right. Thank you everyone for joining us here via Zoom as well as on our Facebook live stream. Today we are doing the Yukon-Kuskokwim Health Corporation welcomes you to a virtual town hall with a couple of our healthcare partners to talk about COVID-19 vaccination in children ages 5 to 11. I'll be your moderator today. My name is Tiffany Zolkuski. I'm the Vice President of Communications here at YKHC. Before we begin, I want to thank Paul Walker, the General Manager at KSKO Radio, who is live streaming this on KSKO station in our upriver communities, as well as KYUK for live streaming to our listeners here in the YK Delta. YKHC is proud to offer this information directly to our service area to provide information about the COVID-19 pandemic and all of the work that we're doing to help continue to fight this pandemic. Before I hand this over to our president and CEO, I wanted to give an update to our listeners and our participants about how to access COVID-19 vaccinations for children ages 5 to 11 in the YKHC service area. So a quick note here, we want to make sure that the public does not use the online form that we've been using for vaccine requests for individuals aged 12 and older. If you are in Bethel and you're interested in getting a vaccination appointment for children ages 5 to 11, we are offering them today, Friday, as well as a clinic this Saturday. And you can schedule an appointment by calling 543-6949. Again, you would call the COVID-19 hotline at 543-6949. Beginning on Monday, November 8th, we will be having pediatric vaccinations available Monday through Friday. In villages, YKHC will be launching what we are calling Project Togo Junior this Sunday, November 7th. And so we will be providing more information to the public on what that schedule looks like. We are working directly with schools, village clinics, and communities to get those in-village vaccination clinics set up. So thank you for your patience as we continue to pull this information together in real time. If you are eager to get your child signed up for a COVID-19 vaccination and you're in one of our villages, please give a call to your local village clinic and they'll be sure to get you on the list for when YKHC is in your community. We continue to collaborate with our region's school districts to hold in-school vaccination clinics when they are readily available. And again, we'll provide additional information as that is forthcoming. With that, I'd like to hand it over to YKHC's President and CEO, Dan Winkleman.
Yeah, good afternoon, and thank you, Tiffany. Thank you to all the listeners, and thank you to our panelists. This afternoon, we have Dr. Ellen Hodges, YKHC's Chief of Staff, Dr. Elizabeth Bates, YKHC Infection Control Director, Ella Goss, our Chief Executive of Providence, Alaska in Anchorage, and then also Dr. Matthew Hirschfeld, pediatrician from the Alaska Native Medical Center. He is also the Medical Director of Maternal Child Health Services. Welcome all, and good afternoon. Dr. Hodges, can you give us a regional COVID update?
Absolutely. So our COVID case rates continue to be relatively high. We are noticing a bit of plateauing in the numbers, and we hope that that stays this course over the next few weeks, and we'd like to see them go down as well. We have not yet seen a significant decline in cases. However, there is hope on the horizon. The case rates in the state of Alaska are starting to go down as they have in the lower 48. So we have great hope that especially with the addition of this age group for vaccinations that we can make our case rates go down more than they already have. But they do continue to be fairly high, and we are in what we consider a high transmission zone in all areas of our region. Because of that, we're strongly encouraging vaccination in all folks who are eligible, and to also include non-pharmacological measures such as masking, avoiding large groups, and frequent hand washing as well, to continue to mitigate not only with vaccination, but also with other strategies to reduce our risk of transmission of COVID in our region and in our state. And thank you. That's the end of my update.
All right, thank you. Next, we're going to go to Ella Goss, and Ella, like I said, is the Chief Executive for Providence, Alaska. As many listeners know, We have many referral hospitals. Besides Alaska Native Medical Center in Anchorage, we're also been medevacing COVID patients to any of the larger referral hospitals in urban areas. One of those is Providence. And I was wondering if Ella could give us an update on their capacity there in the South Central region.
Thanks so much. Yes, so the good news is our capacity is getting much better compared to what it was 2 weeks ago. In the last 5 to 7 days, we've gone from 35 to 45 active COVID cases in the hospital needing PCU or higher level of care, down to 20 today with 37 patients who are still considered COVID patients, but not actively COVID, just needing hospital support. That helps us with our capacity in that our ICU is not as busy as it was over 2 weeks ago, and it allows us to have a little bit more breathing room to move people around should we have a surge. We've also increased the ability with these numbers to be able to accept transfers from other areas, whereas 2 weeks ago, we were in a position where it was very difficult for us to accept transfers, and we had many people waiting on transfer, not just in the Anchorage area, but throughout the state of Alaska. Like Alaska Native Medical Center, Providence Alaska Medical Center is one of the facilities that accepts a large number of transfers from all over the state. And especially when there are influenzas and different things in the smaller communities, and people need to be moved quickly. So it is important for us to be able to accept those patients.
Yeah, and I want to thank you, as well as Dr. Hirschfeld and their team there at the Alaska Native Medical Center. You've been fantastic partners for the last, I want to say 22 months of this that we've all been going through. It's amazing. I was just thinking how long this has been going on. And for the listeners, we've also been at capacity until the last week. Our inpatient census this last week has dropped to about 15 on average. It goes up and down quite rapidly. I think today we had 4 COVID patients this morning when I last checked, but it rapidly goes up and down, as I'm sure the larger hospitals are experiencing in Anchorage. But hopefully we are plateauing, and hopefully it will go down for us here as well. With that, let's get right to the kids. Everyone wants to know about the kids and how to get the vaccine, right? And we're lucky enough to have a great pediatrician here. And I was going to ask Dr. Hirschfeld at the Alaska Native Medical Center, if you're somewhat of a hesitant parent, how can you explain the risk-benefit analysis that one does? I know lots of parents have heard this phrase about a risk-benefit analysis. It's kind of hard to understand what exactly that is when you hear all these different terms on the news for the last 2 years. How can you explain that to a parent and why it's so important to get this safe and effective vaccine for kids?
Well, first of all, thanks for the question, and thanks for having me on the panel. It's a great question, and one that we think about all the time in pediatrics. The way I try to explain it to families is the risk of getting the vaccine, for no matter what the side effect is that you hear about with the vaccine, except for maybe the sore arm, is much less than the risk of whatever you're talking about with getting COVID. So one of the things that you hear most about is like the myocarditis, or they get an inflammation of the heart with the vaccine. It's very rare. We very rarely see it in kids, but it does happen to a very small number of kids. But the number of kids who get COVID who then have myocarditis is much higher than the kids who get the vaccine. And so, I like to think of it as the vaccine, although it does have side effects, as all medications and all vaccines do, the risk of those side effects is much less than if you actually got the disease of COVID itself. And of course, the risk of not getting the vaccine goes up exponentially as your child has increasingly complex medical issues. So kids who maybe who were born premature, or kids who have been in the PICU before, those kids have a much higher percentage of kids have pretty serious complications with COVID. And so getting them the vaccine is really important. And then also getting all the kids around them the vaccine, because kids pass viruses back and forth. And so the more kids you can get vaccinated, the more it's going to protect not only the kids, but the kids who maybe have some complex medical issues, as well as adults that have complex medical issues that come in contact with those kids. So the risk of not vaccinating is always higher than the risk of vaccinating.
And I have just one other question, maybe a follow-up that Dr. Bates can help us with. Have we seen some of those complications here at our facility with kids?
Yeah, we definitely have. And so particularly with the surge from the Delta variant, we've seen increased hospitalizations in children as young as 10 months. And this is, a concern that we continue to have, especially as we move into respiratory season. We have a higher risk of chronic lung disease in our kids, things like bronchiolitis and RSV. So that's why we're working so hard to make sure vaccines are available across the YK Delta, because it's so important to protect our kids from this deadly virus. I think we've saw that trend everywhere, but particularly here in the YK Delta, we've been, I think, disproportionately impacted, especially our kids. So it's definitely why we're working so hard to make all of this available.
And certainly we've seen that at A&MC and the PICU, and I know they've seen it at the PICU over Providence as well. We're seeing more kids get admitted with COVID and they're sicker, and also pregnant women too. But another plug, just to another group that it should be vaccinated absolutely is the pregnant women, because we're seeing lots of pregnant women come in sick, and then it's hard to take care of your baby if you're in the ICU.
All right, this is such a great segue into our virtual town hall today. And one of the things that we love about the opportunity to connect over Zoom and on our live stream is the opportunity to take questions. So for those viewers who are joining us on Facebook, please know that we are monitoring questions that come into the comments of the live stream. So go ahead and submit any comments that you have in the live stream, and we'll get to those as we can. For anybody who's joining us in Zoom today, go ahead and use the Q&A or chat box to drop your questions in for our physicians. And why don't we go ahead and maybe start talking about some of the data that we know. So we'll hand this over to our physicians to get started in helping us understand the data around the pediatric vaccinations for children 5 to 11 years old. Can you talk a little bit about the efficacy? When a child is vaccinated, what does that process look like with respect to how many doses do they receive? How frequently should they, how many days separated should they receive those doses? What does the efficacy look like? Let's start there.
Sure, this is Dr. Hodges. I can get started with that. So the data that was submitted to the FDA and reviewed by the CDC Advisory Committee on Immunization Practice indicated that the vaccine was about 91% effective in this age group, so 90.7, which is very, very effective. There were no serious events, adverse events in the study group, so no serious outcomes happened among the kids who received the vaccine. The vaccine is, it's different than the adult formulation. It's not like we're just taking the adult formulation and giving a smaller amount to the kids. It's a completely different vial, and it's mixed up in a completely different way, and it's a different dose. It's 1/3 of the dose given to our 12 years old and up. So it's a 10 microgram dose instead of a 30 microgram dose. It's 2 doses, 21 days apart. So, and there's a little leeway in there. It can be given between 19 and 22 days. So we're going to, for the villages that we're going to start trying to get out to those villages, weather permitting, about 19 days after we visit them the first time to vaccinate our kids. So that is that's the summary of the cases there. The other thing I think I was hoping that Dr. Hirschfeld could maybe comment a little bit on is the differences between an adult and a child immune system. This is not weight-based, this is age-based for a good reason. And I was hoping Dr. Hirschfeld could comment a bit on the immune system of a child and why we have maybe a smaller dose might be just as effective as a bigger dose, even though an 8-year-old child might weigh as much as a 12-year-old child.
Sure, Dr. Hodges, I can comment on that. I think many of us wish that we were kids again for many reasons, and one of the many reasons that you would wish to be a kid again is because your immune system is fully functioning and has a very vigorous response to vaccines. One of the reasons that we have to use the higher doses in older kids and adults is because the immune system is older and it just doesn't work quite as well as the kids under the age of 12. And so we can use a smaller dose in these kids because they really generate a lot of antibody. They generate antibody quickly, and they can and it's just a great place to be at for an age where you're getting a vaccine, because it really your immune system is functioning very well at that age. And so if everybody could be 11 or 10 again, we would have a very effective vaccine for this, but the rest of us need a little more of a dose to be able to generate the same immune response that kids do.
We received an email, maybe in a follow-up question. We received an email from a parent last night in anticipation of this town hall, and they were curious about understanding there being a growing body of evidence and data, research and data that is showing a longer time interval between the first and second dose of a vaccine could improve long-term immunity, and the current time interval between doses was decided in part by the need for quicker completion of the trial when a vaccine was desperately needed. Can you speak to whether the current recommendation of the intervals between doses, should that remain at 3 weeks? Does the data support that, or would it support further spacing out intervals between doses, such as 4 to 6 weeks between the first and second dose?
Sure, and I can take a quick stab at this, and Dr. Hirschfeld and Dr. Bates could help me as well. So the studies were based initially on when you would get the highest amount of antibody response for protection from this deadly virus. So when they picked the 21 days for the Pfizer and the 28 days for the Moderna, that's what it was based on, these antibody studies that showed that had the biggest increase in antibodies for the least amount of side effects. So we strongly recommend that 3-week interval for Pfizer so that kids can reach full protection, which would be achieved 2 weeks after that second dose. So that would be the strong recommendation. And it was based on the initial safety trials that were done at the very beginning, the phase 1 trials of these vaccines to determine the optimum timing of the second dose.
Yeah, and the only other thing
Sorry, go ahead, Dr. Bates.
The only other thing that I would add is that there's some data that also suggests that this antibody response lasts longer in kids. As Dr. Hirschfeld described, their immune systems are just more efficient and effective at protecting them against these infections. So I think that's also reassuring to know that this vaccine will be highly effective at protecting our kids for a long time.
Another question here from the same parent is, can you talk about how distribution of the smaller child doses will be handled with respect to the size of the needle? Will there be smaller needles used in the pediatric vaccinations? And can you talk a little bit about the need for doing that?
Sure, I can start with this one as well. When we get our distribution of vaccine, we also receive from the government the appropriate supplies to administer the vaccine. And they did send out the shorter needles for the administration for kids for this vaccine. So it's a 25 gauge 1-inch needle, which is a little bit smaller and shorter than the one used to vaccinate adults. But we also use that type of needle to vaccinate small adults as well. So it'll be the most comfortable that we can. It's still a poke and we can't change that. But it's the most appropriate size needle for that vaccine.
Great. So just a friendly reminder, if you're following along on our Facebook live stream, go ahead and comment your questions and we'll be happy to get to them as we can. If you're joining us by Zoom, go ahead and use the Q&A or chat box to drop your questions in. One question that we received is what level of vaccination in schools or community would we need to see before some of the stricter rules might be considered for relaxation? I know that level of community transmission, especially among a younger population in our region that was previously unable to be vaccinated, plays a part. So can you speak to what level of vaccination would need to be achieved to ensure that there's adequate protection to help us move beyond the current outbreak that we're seeing in the YK Delta?
Sure, this is Dr. Hodges again, and I can start off on this one as well. I think that what we look at more than the number of people vaccinated is the background rate of cases. So in other words, if we of course want 100% of the eligible people in our region to get vaccinated, that would be the ultimate goal. But if that, in light of the fact that we can't vaccinate the 0 to 4-year-olds yet, there's still going to be a significant portion of our population that will remain unprotected. So what we would do to recommend for communities to lift the mitigation strategies, such as mask wearing, avoidance of large gatherings, and frequent hand washing, really would be amount of the background cases that we have in each community. And right now, the amount of background cases we have in each community is very high. So we wouldn't recommend a relaxation at all in those, and I would recommend that people keep an eye on our case rates to help determine that.
So a question here for all of our physicians, just about long-term effects. A lot of parents are having to consider vaccination choices for young children. Are there any concerns with respect to long-term effects of a new type of vaccine? Can you talk about the science behind the pediatric vaccine and recommendations you would make as pediatric and physicians?
Maybe I can take that one to start. So this is Matt Hirschfeld. These are relatively new vaccines, and so we don't know everything about the long-term effects. But all of the studies show that the long-term effects of the vaccine are relatively minimal. What we do know much more about are the long-term effects of getting COVID as a kid or as an adult. There is something called MISC, which is a long-term COVID response, which is basically an overwhelming inflammatory response that happens somewhere around 3 weeks after you catch COVID. And those kids can have, they end up in the PICU, they end up very sick. Kids can have long-term COVID like the adults do, where they can have, the brain fog and residual lung problems, just like the kids with RSV do. And so I think we know there are long-term effects of getting COVID. We know there are almost no effects as far as we know from the COVID vaccine. And so I think that again, going back to like my original question, the original question from Mr. Winkleman was, we know that the risk of getting long-term issues with COVID is much higher than the vaccine. And so again, the vaccine is always recommended.
Yeah, and the only thing that I would add is, we've had tens of thousands of kids in the United States who've been hospitalized. We know that if hospitalized patients are higher risk for long COVID or having symptoms associated with COVID for more than 3 months. We also know that 657 kids have died in the United States. And we here in the YK Delta have had 3 cases of MISC. And the majority of those were kids who were completely normal. They didn't have any chronic medical issues. They had gotten COVID, recovered from COVID, and then developed this multi-system inflammatory syndrome, 2 weeks after. And so I think that was really scary for us as providers to know that this this incredibly serious disease that basically causes acute onset heart failure in relatively healthy kids is possible in our region. And so, that's why I think it's so important to get vaccinated, because, we don't know, that's true, we don't know everything about this vaccine, but we do know that for the most part, vaccines are temporary. That's why we need to get boosters as adults. And we do know that COVID-19 has long-term, as Dr. Hirschfeld described, consequences for both adults and kids. I was reading one study that anywhere from 2 to 5% of kids can develop long COVID. And that's pretty scary. It means that maybe they can't play for as long, or they can't go out and fish or hunt the same way that they did before they got COVID. So those are things that we think about when we talk about why it's important to get this vaccine. Thank you.
Dr. Hodges, I know we were just talking about a recent study that came out that said regarding long COVID that 50%, up to 50% of people that were infected were still suffering from one or more symptoms 6 months later. Is that, can you talk a little bit about that and how serious long COVID can be?
Yes, it is a very serious condition, and there is no known treatment for it at this point in time. And we have had many, many patients in our region suffer from this. It's frustrating for them. It's frustrating for the people who have to take care of them. And the most common symptoms are persistent shortness of breath and chest pain, as well as an overwhelming fatigue and headaches, fevers that can continue. And this disease affects, like Mr. Winkleman just said, up to 50% of people who got COVID who weren't even seriously ill. If you ended up a person being hospitalized or in an intensive care unit with COVID, this can affect up to 90% of those patients. And it has really long-term effects. We've had people who can't return to their jobs, who can't work again because they have been so severely affected by this. And as Dr. Bates was mentioning, this also can happen in kids. It's a smaller percentage in kids, but it's not zero. It's not a zero amount of kids. So I think that's something that I think about all the time when I think about recommending this vaccine to absolutely everyone who can possibly get it. This is not a disease that you ever want to catch and be like, well, I'll just let my natural immune system fight this off. Because of the risks of the long-term consequences of COVID. And I think Dr. Hirschfeld was talking as well about some of the heart inflammation and the heart damage from COVID and MIS-C, that multi-system inflammatory condition that kids can get, and adults can get it too. But we have seen this a lot in our population. It's very serious, and the best way to avoid that is prevention, and that's vaccination at this point in time.
Another question here, and just a friendly reminder for those folks who maybe have just tuned in to today's town hall. If you're in Bethel and you're interested in getting your children ages 5 to 11 vaccinated against COVID-19, we are holding clinic hours tomorrow on Friday, as well as this Saturday, and then beginning Monday through Friday of next week. If you're in Bethel, you can call 543-6949 to schedule an appointment. In Villages, we'll be launching our travel this Sunday. We are still working on finalizing the schedule. If you're eager to get your child vaccinated when we have a team distributing pediatric COVID vaccine, please give your local village clinic a call and your children can get signed up that way. A couple of quick questions here, and then I'm going to turn to Ella for a question. Can you speak to, are there any instances where you would not recommend vaccination, where you would not recommend the vaccine for a child? And can you give us an update and any idea when vaccines will be available for children younger than 5 years old?
Sure, this is Ellen Hodges. I can get started on that. So the only contraindication to vaccination is an allergy to one of the vaccine components. So if you're, and the vaccine components are listed on the internet, you can go over them. The vaccine or allergies to these types of components are very rare, but it's not that no one has allergies to that. So if you're concerned about it, those ingredients are available on the internet. The most common ingredient that people might have allergies to is the polyethylene glycol, or PEG. It's a very uncommon allergy, but it is in some other medications. And so if your child has a severe reaction to that particular component, we would advise against getting vaccinated. Other than that, there are no contraindications for that.
And the only other thing I would add is that, there are only like 5 ingredients in this vaccine, in the mRNA vaccine, the Pfizer, and there are more ingredients in Blue Bunny ice cream, and I will eat that stuff all day without any hesitation. So I understand the vaccine is different than ice cream, but just thinking about, we're exposed to lots of things all the time, and the ingredients in this vaccine are very safe. It's now been given to millions of people around the world. And so I think, just thinking about that, putting it in that kind of context was helpful for me.
I think just to add on to the 0 to 5-year-olds, those studies are ongoing, and I personally don't have a good idea of when that's going to be approved. I'm hoping early next year, but I can't swear to that.
Great, thank you. And for any listeners that are having any delayed internet connectivity or challenges with the audio today, please know that we are recording this. It'll be on YKHC's YouTube page as well as our Facebook page and posted on our website. A question for you, Ella. Providence, much like ANMC, is a solid partner of YKHC's, particularly for care of our intensive needs care patients and patients that are experiencing high acuity of illness. Can you talk about how opening pediatric vaccination for 5 to 11-year-olds of COVID-19, how you anticipate that might have impacts on the strain that you have been experiencing at Providence, that we've been seeing statewide? Can you speak a little bit to that?
Absolutely, thank you. So many of you know that we have a children's hospital here at Providence, and our pediatric intensive care unit is a 10-bed unit. Our NICU is a 60-bed unit, and our PEDS unit is 30 beds total. When you think about the number of, and I can't speak to the exact numbers that are at ANMC, when we look at the total number of pediatric intensive care beds and the number of pediatric beds in the state, we don't have a significant number of beds to facilitate any kind of surge with pediatrics. And if we think about in the past when we've had RSV really take over some of our remote areas, and I'm thinking of Barrow and Bethel in particular, transferring those patients to PAMC and to ANMC becomes much more difficult when you have those higher number of really ill children, because we just don't have the capacity. We have less pediatric capacity than we actually have of adult capacity. So encouraging and really supporting all of our children getting the vaccine and listening to the healthcare experts that, just like our esteemed colleagues today has said, they've all said the vaccine, the vaccine side effects are so much less than COVID. And even if a couple of the children end up with some side effects or symptoms and feeling ill from the vaccine, it is so much more limited than the actual COVID signs and symptoms and how sick the children get. And especially in our more vulnerable populations where lung conditions and other immunocompromised conditions are at the highest, the children really need to be vaccinated against those, against COVID, to help decrease or eliminate the number of children who will contract COVID. So the impact of the getting the vaccination will decrease the number of children having to be transferred from their hometowns and their home facilities to Anchorage. It decreases the stress on the families, it decreases the stress on the healthcare system, and it certainly decreases the stress on the children if they do not contract COVID. The sore arm, the side effects of the vaccine may seem a little bit scary to people, but many of us have had the vaccine. We've lived through the sore arm, and I think we can say the same for our kids because they're very, very resilient. So it would be a huge decrease in the impact on the hospitals if everyone moves forward and gets the vaccine.
Thank you so much for that. Something that you said, Ella, reminded me of a question that we had that came up when the COVID vaccine was initially coming out for adults in 2020 and early 21. So I would ask our physicians, can you define the difference between an adverse reaction to vaccination and side effects of vaccination? Can you talk about the safety of a vaccine, even if side effects are experienced, and how that's different from adverse reactions?
Sure. This is Dr. Hodges. I'm happy to start with that one. So the side effects are sort of those inconvenient things that happened to all of us after we got the vaccine. Like Ella was mentioning, my arm sure hurt after the vaccine. And it was inconvenient and uncomfortable. But an adverse event is something that's much more serious that occurs after a vaccine that we might link to the vaccine. And when the ACIP was reviewing the data for the childhood vaccines, they made a comment, and when I was listening to the meeting, that the COVID-19 vaccines that are being administered right now in the United States are undergoing the most intensive vaccine safety monitoring effort in history. And that is true. The VAERS, which is the Vaccine Adverse Event Reporting System, as well as the VSafe system, which is a smartphone application where you can report your own side effects and your own symptoms, have really been robust in this particular vaccination drive, so to speak. And so we call them signals. When something comes up that might be associated with a vaccine, it's called a signal. And these signals have been picked up very, very quickly in the distribution of these vaccines. And the same goes for the childhood vaccines when they're distributed. So people can rest assured that a ton of effort and time has gone into ensuring that these vaccines are safe and effective and monitoring them after they've been released, and many more kids are vaccinated, so that if there is a problem, we can identify it right away.
Great, thank you. Another question here is, Dr. Hodges and maybe Dr. Bates, can you speak about what % of total cases in our area are in 5 to 11-year-olds? And just a quick side note for anybody listening, YKHC has started publishing age demographic data of cases previously reported in the last 7 days on our dashboard, ykhc.org/COVID-19. If you're interested in taking a look there. So I'll pose that question, but then in a follow-up question for any of our physicians, any of our panelists, can you speak to whether children who previously had a COVID infection should get vaccinated?
Sure, I can start off with the percentages. This is Dr. Hodges. So overall, about a quarter of our cases in our region since the start of the pandemic have been in children under the age of 12. In the last outbreak surge of the Delta variant that we've been noticing in our region since August, that number has increased to about a little over a third. 34.4%, probably because many of the adults are vaccinated. And nationally, people saw that too. The kids started to take over a bigger proportion of the cases. So about 40% of our cases are in kids under the age of 18. That's a huge amount. And it's bigger than the national average because our population is younger. And I'll defer to Dr. Hirschfield on the children who have previously had COVID, if they should be vaccinated.
This is Matt. Yes, that's absolutely true. Kids should be vaccinated even if they've had COVID. The immune response that happens from the infection appears to generate less of an immune response than the vaccine immune response. So even if you've had COVID, no matter what age you are, you should still get the vaccine and get the full course of vaccines, and then get all the boosters as those come out, because the immune response from actually getting COVID wanes, and it seems to and the vaccine will just be that extra protection to make sure you don't get COVID twice. So yeah, the kids are the same as the adults and the older kids.
And we've seen that in kids who are unvaccinated, who cannot get vaccinated. We've seen recurrent infections. I remember there was one patient in particular who got COVID like 5 or 6 months after his first infection. The poor guy, to have to quarantine twice in 6 months. And so getting vaccinated will, reduce his chances of getting COVID again. There was just a recent study that says somebody who is naturally immune or had an infection versus somebody who is vaccinated, their risk of being hospitalized is 5 times higher than that of somebody who is fully vaccinated. And so I think that was helpful to frame this for me. And the other thing, a recent study I just heard about is, younger kids are increasingly likely to transmit COVID to family members. So if they're a household contact and they're under the age of 6, they're more likely to pass it to other members of their family. So getting your child vaccinated will not just protect them, but it could protect you and the rest of your family, particularly those who are under the age of 5 who can't get vaccinated. I think that's a population that we really want to protect too. Thank you.
All right, I'm going to jump in here with a couple of quick reminders. If you are joining us today on Zoom, go ahead and drop all those questions into the Q&A or chat box. If you're joining us on the Facebook live stream, go ahead and drop your questions into the live stream, and we can get those questions answered as we have them. Also, a friendly reminder, if you're a parent of a 5 to 11-year-old and you're interested in getting them vaccinated against COVID-19, in Bethel, call 543-6949. In Villages, call your local village clinic and I'll take down your information. All right, Dan, I wanted to hand it over to you for asking the next question.
Yeah, can Dr. Hodges or Dr. Bates describe the process a little bit this time around with kids? I know it's a little bit different from when parents or adults came in and got vaccinated, but can you just describe what parents can expect when they show up with their child at either as an appointment or a walk-in when they're getting their vaccination?
Absolutely. So here in Bethel, we are vaccinating on our second floor wellness center. And you can expect to be completing some paperwork, which is a consent form to give us permission to vaccinate your child. You will also be offered information. It's called the Emergency Use Authorization document that we are required to provide to you, which is sort of a hefty document talking about the vaccine. And we also have distilled this into sort of a 2-page fact sheet that's a little bit easier maybe to understand and read. So you'll be handed this information. Then your child will undergo vaccination. Because we want to keep the kids under observation for about 15 minutes after their vaccination, you will then be asked to wait in the wellness center. There's some chairs set up to wait for about 15 minutes. And if everything's fine at the end of 15 minutes, you'll be free to go. Quick reminder that we'd like you to make sure you come back in 21 days, between 19 and 22 days. So we want you to come back, or 19 and 23 days, we want you to come back and get that second dose of vaccine. You'll be given a card, the official CDC vaccination card where your vaccine will be recorded on for your child. And it's important that you bring that back to your second appointment so we can keep track of that on the card for you as well as in your record. The vaccine will be entered into your record. And in Alaska, all vaccines are transmitted to the state program called VacTrack. So the state of Alaska will also have a record of that vaccination. That's how the state gets their numbers on who's being vaccinated in the whole state. And so that whole process that you're going to be undergoing will take about 30 minutes from the time that you get there, fill out the paperwork, get the vaccination, and end up in that observation period afterwards. For village-based clinics, it'll be an extremely similar approach. We'll have if you're a parent that wishes to accompany your child, if you're getting a vaccine in a school, exactly the same process. It's important that you look at that information that we send home with you. It might seem sort of dull and boring to read, but that's an important part of the vaccination process that you kind of look that over. And again, that observation period is also very important. So thanks to everyone who is bringing their kids in. I'm so excited to have the vaccines start today. Down there, Dr. Bates and I are flipping coins over who gets to vaccinate the first kid.
One follow-up. So what kind of minor side effects should parents be looking for in their child after they're vaccinated? The reason why I ask is because when my 15-year-old got vaccinated, she was totally fine and didn't have a sore arm or anything. It was great. Yeah,
I think Dr. Hirschfeld mentioned it best. Don't we wish we were all young for lots of reasons, but probably this is another really good reason. Yes.
She was making fun of me, in fact, the next day. Dad, what are you talking about? You had a sore arm. Right, sure.
Yeah, exactly. So the kids had way fewer side effects in the trials that were done. They did have sore arm, and of course, a certain percentage of them had body aches, headaches, muscle aches, fatigue, that kind of thing. But it was much less, about a third less than in adults. But that's what people can affect. If that happens, we recommend that people use Tylenol for those side effects, and also maybe a hot pack or an ice pack over the site to help with the soreness for that. But yes, the kids were experiencing way fewer side effects.
A question for Dr. Hirschfeld. is it common, will children who do not experience side effects or any type of side effects, will their bodies continue to also mount an immune response to COVID-19? Can you speak to those side effects? And we talk about them a lot as something for the public to be aware of, but sometimes, like Dan was saying, somebody might not necessarily have a side effect the next day. Will their body continue to be making antibodies that will protect them against COVID-19 in that situation?
No, that's absolutely true. You know, Dr. Hodges just talked about how kids had a third less side effects than the adults, but we know that the kids, even though they're having less side effects, they're still making better antibody response to lesser dose of vaccine than the adults. So even though the kids aren't having the same side effects, that's because their immune system is working very well, and it makes the antibodies at a very high level, but they don't get all the side effects. And so again, you know, it's always good to be a kid. So yeah, it doesn't, the side effects are not, the amount of side effects are not linked to the amount of antibody you make.
Great, a question.
Are you sure, Dr. Hirschfeld? Because I had lots of side effects, and I like to think of myself as having a high amount of antibodies.
There are cases where certainly that is the case, where lots of side effects, you'll be immune for the rest of your life, Dr. Hodges.
Thank you. The other point I was going to make on this is that the vaccine itself, the actual thing that teaches your body to make the antibodies disappears after a few days in your body, about 72 hours. It's chewed up by your own body. And it acts as a trainer or a teacher to your immune system. So the antibodies that are produced by your own body to the vaccine. So we're not giving you anything that helps your body fight off the infection, except for the instructions to do it itself. And I like to think of it that way when people worry about some of the long-term effects of the actual vaccination, is that vaccine disappears in your body after a few days. And what's left is this instruction manual to teach your body to recognize the invader, the COVID virus, and to kill it. So that's kind of how I like to think about it. And if that helps parents think about the long-term effects of this vaccine, that helped me when I was wrapping my mind around it, because this is relatively new technology for vaccinations. But that's one of the coolest things about it, is that it's sort of a brief visitor to teach everyone how to fight the invader, and then it disappears.
And I just, you know, it is a relatively new, this type of mRNA vaccine, but mRNA vaccines have been researched and studied for over 20 years, started with the original SARS virus in the early 2000s. I think 2000 is when they first started looking at mRNA vaccines. So there has been a lot of research and data done on these vaccines. And so we do know that they are highly safe and effective. As Dr. Hodges says, they're in the body briefly. You know, our bodies are really efficient at chewing up things that they don't recognize. And then these side effects are really, you know, this body aches are just signs that your body is making a response and that your immune system is being activated. So I know Dr. Hodges wore her side effects as a badge of honor. I think that was helpful for me too when I had my little day of fatigue afterwards.
One question that we received, and I'm going to punt this over to Ella and then ask Dr. Hirschfeld to weigh in here. One question that came in on our live stream is this vaccination happening in other places other than Southwest Alaska? And can you touch on briefly whether pediatric vaccinations have started in other parts of Alaska and the country?
So I'll jump in really quick. We haven't started them as of today, but our clinics are getting ready for those. Within PAMC ourselves, we are not going to host a pediatric vaccination clinic because we would have to bring all of those children into the hospital and go through a vaccination clinic that way. And that would just increase the possibility for exposing kids to things they don't need to be exposed to. But what we are doing is in our express cares, in our urgent cares, and in our family practice clinics, the vaccination, as soon as we receive vaccinations, we'll start giving out those vaccinations. And as far as I know, and Matt may be able to, Dr. Hirschfeld may be able to speak to this even better, is that the municipality, public health, and the school district will also start with vaccination clinics in the schools and with the public health nurses and school nurses to start giving out those vaccines to the kids.
No, I agree completely, Ella. I'm always impressed with how fast YK can roll stuff out, because you actually are beating us by a full day at South Central Foundation. We're starting on Saturday. You guys are starting on tomorrow. So again, your kids are going to be better protected than probably any other kids in the state, because I don't know anybody who's vaccinating starting tomorrow. So that's great news. It is being used. So this was approved across the country. So any place in the U.S. and the U.S. territories can start giving vaccine as of right now to 5 to 11-year-olds. So this is nationwide and being used across Alaska as soon as people can get it up and running.
Great, thank you, Dr. Mitchell. Dr. Hodges, go ahead.
Oh, I was going to say, yes, it's also been given nationwide. In fact, I saw maybe a picture in the ADN that they were giving it at the Anchorage School District today.
Yep.
So some of the kids in Anchorage certainly are getting it, but it is a nationwide vaccine, and we have very high rates of transmission here in the YK Delta. They're some of the highest rates in the nation. And I think whenever I look at the New York Times or the Johns Hopkins COVID tracker, I'm always sort of humbled by how high the rates are. They really are high in our region. The Bethel census area is frequently at or near the top of the New York Times list of transmissions. And so that's one of the reasons why it's so important that we get this vaccine out to as many people as possible, as fast as possible, because this virus is extremely contagious, and the more people we get vaccinated against it, the more of these other complications that we have been discussing today can be prevented.
Let's talk a little bit more about that. Schools. These are all school-age kids that we're talking about, and how is this going to improve keeping our kids in school, keeping them active with extracurricular and sports activities that all parents and all kids look forward to, and really after the last year not being able to do all that to the extent everyone would wanted to, how do we expect this to help with that?
Yeah, absolutely. This is going to be a game changer for that age group, keeping them in school, not having to quarantine if they're a close contact, and then of course just not catching COVID. It's extremely disruptive for a family to have a hospitalized or a very ill child, and I think all of us who have taken care of hospitalized children are aware of that. It's really hard on the family, and so the less disease burden we have in that age group, the better off it is for the kid, and the more they can stay and be in school, the better off they are. We learned that this past year. It's really hard on kids not to be in school. It's hard on them socially. It's hard on them academically. It's hard on them emotionally. And the rates of depression and anxiety in that age group is astonishing. So the more we can do to keep our kids in school in person, the better off everyone is going to be. And I think vaccination is a big, huge leap towards that.
Yeah, and I think this will make it possible to do things like have wrestling meets safely, travel between villages and even to Anchorage. We know people who are fully vaccinated are, at least 8 times less likely to get COVID, 8 to 12 times less likely to get COVID if they're exposed. And so I think this will be a great tool to reduce the number of cases in our region. And just the other thing I want to add, since Dr. Goss and Dr. Hirschfeld are both on, I think a lot about ICU capacity too in our region. I think it's something that we've seen over the last month here. We've been stretched excruciatingly thin, and I think still stretched quite thin, particularly for adults intensive care units. But certainly in the winter, we here in the YK Delta, we fill the pediatric ICUs in Anchorage with our patients every year. For decades, I would say, and I think last year something like 60% of the patients in the ANMC pediatric ICU were from the YK Delta. And correct me if I'm wrong, please. So I think moving into respiratory season, anything we can do to reduce the burden on our healthcare infrastructure, to reduce the number of COVID cases we have in this vulnerable population, in our pediatric patients or patients with chronic lung disease, we need to work really hard to make that possible. So that's why we're strongly advocating for everyone to get vaccinated and to get your kids vaccinated as soon as possible to try to preserve our healthcare capacity here in the state throughout this winter.
And if I could just jump in really quickly, first of all, thank you, Dr. Bates, but I am a nurse by trade, not a physician. And I'm honored to be sitting here with this panel of esteemed physicians. But what I would say is that while yes, unfortunately for our pediatric patients and their families, many pediatric patients get transferred to the Anchorage area, either to our hospital or to ANMC. But we are happy to help with the burden and ensure that we are providing whatever level of support that we can support to the communities and to the patients. One of the things that I always say, and I see ANMC, YK, Barrow, Manilik, all of the other facilities as very, very strong partners, is that we consider our community the state of Alaska, and that any way we can support all of the patients and all of the communities in Alaska, we are happy to do so. So it's a burden for the families, but any way that we can help, we're happy to do so. No need to ever apologize for sending patients to us.
You know, I think
so much. You have been amazing.
I think last year was a very interesting year. I think we only took one respiratory patient from the YK Delta at ANMC, which is, you know, hundreds of patients less than we usually do. And so I think, you know, going back to what Dr. Hodges said early, where, you know, using other mitigation methods other than immunization for people like masking and hand washing and all that kind of stuff, that worked very well last year for the kids from a respiratory standpoint. It wasn't great that they were out of school, and it wasn't great that they were socially isolated and all that kind of stuff, but those really do work, and they do keep kids healthier.
One follow-up with that, that kind of talks to the flu vaccine and that being available during our COVID clinics. What is the plan for that, Dr. Hodges and Dr. Bates? And is that a good idea? I think I know the answer.
That's you know the answer to that. Yes, very good idea. We will be having a flu vaccine at all of our COVID vaccine clinics. You can get it in our wellness center here in Bethel and in all of the village clinics that we're going to be traveling to in the next 2 weeks to partner with the schools to get kids vaccinated. So yes, we're strongly encouraging flu vaccine. Again, just like last year, we cannot have an outbreak of another respiratory illness on top of COVID. Our healthcare system is too fragile to tolerate that. So everyone 6 months and older needs to get a flu shot as soon as they can. Does make your arm hurt a little bit as well, probably less than the COVID shot, and you can get them at the same time. We recommend that you get them in different arms, just in case you have a reaction to one or the other of the vaccines. You will know which arm or which vaccine caused it. You can get them in the same arm. Some people do, but we do recommend different arms. They can be given at the same time.
All right, I'm going to jump in here with the last few moments that we have left and thank all of our incredible panelists for coming together and making some time for such an important conversation and answering so many questions. For folks who might have missed our reminder earlier, and just to correct Dr. Hirschfeld, we are able to start vaccinating today in Bethel. So if you're interested in getting your children ages 5 to 11 vaccinated and you're in Bethel, please call 543-6949. We will continue vaccination for that age group tomorrow, as well as a special clinic on Saturday and scheduling into next week. If you're in one of our villages, we continue to work with schools to coordinate. We're so grateful for all of our partnerships with regional school districts and with different schools to set up in-school vaccination clinics. The details of that continue to be finalized, as well as our village travel schedule. So if you're in one of our village clinics or village service areas, please give your local village clinic a call if you're interested in getting your child signed up for vaccination. We're so very grateful for all of our health aides on the ground that are champions for vaccinating, particularly children 5 to 11 years old. One quick question that we want to tie up is there a recommendation to a time frame of how soon a child could get their vaccine after a COVID infection? That came in both from one of our Zoom participants as well as on the Facebook live stream. So is there a period of time that a parent should wait if a child from 5 to 11 had COVID and when they should get vaccinated?
Sure, absolutely. And so we recommend that they are not vaccinated during the time period that they're infectious. And the main reason for that, it's not dangerous to vaccinate people in that time period, but because you have to wait that 15 minutes, you risk exposing other people to COVID. So we'd like for people to be out of that 10-day period of time when they're in isolation. And if the family is also quarantining, if you could wait until they're off quarantine. So as soon as that's done, it's safe to get the vaccine.
Great.
Tiffany, I'm even more impressed. Now you're 2 days ahead of us. So great, nicely done to YK.
We want to thank all of our listeners who joined us on our Facebook live stream. We want to thank everyone who has joined us here directly in Zoom, everyone who asked questions. We appreciate the partnership with KSKO as well as KYUK in carrying this across their broadcast. We encourage anybody to give YKHC a call. Again, follow us on Facebook, access our website at ykhc.org. All of this information will be published as soon as it's available. And we continue to partner with all of our tribes, cities, school districts in the ongoing response to COVID-19. Thank you so much, Ella, Dr. Hodges, Dr. Bates, Dr. Hirschfeld, and of course, Dan, for the time today. And we hope everyone will continue to take all of the precautions to take care of one another. And again, if you're in Bethel and you're interested in getting your children 5 to 11 vaccinated, call 543-6949. If you're in a YKHC service area village, please call your local village clinic and stay tuned to all of our channels in order to get information on specific distribution clinics. Thank you so much. Take care. And we hope to see everyone again soon.
Thank you.